Welcome to our first portion of this lecture about E-stim. There are a few different topics that we're going to discuss, kind of combining some of the chapters in your textbook into one lecture. I'm going to try to break these videos up to be a little bit more directed towards the specific applications. So in this one, we're just doing a quick introduction, going to get some of the terminology out of the way, and then in the following videos, I'll break down the specifics like NMES, IFC, TENS, those kind of things. So look for those different videos as we continue to move forward here. But just as an introduction to E-stim, the first thing that we're going to discuss is now we're using an electrical current, which is basically just the flow of charged particles. We'll talk about AC and DC in a little bit more detail on the next upcoming slides, but that's just a different form of the current. So we have AC, which is alternating current, and DC, direct current. Alternating current is just like how it sounds. It alternates direction. These are you can find this commonly used in household electricity, but also in a lot of our E-stim units and devices. DC, or direct current, this just means that this electrical current is flowing in one direction, and we will see this whenever we start looking at something like iontophoresis, where we don't need the alternating current. We actually need something like direct current so that it continues to push medication transdermally through the skin. But we'll talk a little bit more about that on the upcoming slides. The next thing that we need to consider when applying different forms of E-stim are what we call motor points. So these are basically just specific locations where nerves enter into the muscles, making them more of like the optimal spots for inducing muscle contractions. So the motor points are going to be really important for our E-stim applications when we're trying to elicit a muscle contraction, like when we apply NMES or when we apply Russian stimulation. Then we're going to get into these clinical applications of electrical currents. So part of the reasons to why we would use something like electrical stimulation would be to first promote muscle contractions. So this is going to be essential for re-education, improving muscle strength, or preventing atrophy for our patients. But we can also use electrical currents to help control pain as well. So we're going to look at applications like TENS, or transcutaneous electrical nerve stimulation, for pain management. We're also going to look at IFC, interferential current, for pain management. And just remember, we talked about the gate theory of pain control going back into our pain lecture. So this is when we're really going to start to utilize that non-noxious stimulus from the TENS application, from the IFC application, to help mitigate that pain. We can also use E-stim to help control spasticity. So we'll look at these different protocols to essentially almost cause fatigue in the muscles and cause them to relax. So when we think about spasticity, just think of a muscle being overactive. It's not, again, like a spasm that you would typically experience, but this is from some type of upper motor neuron lesion, which doesn't have an inhibition stimulus, so that muscle is constantly contracted. So we can use E-stim to kind of help fatigue the muscle and restore a more normal sense of muscle tone. We can also use E-stim to promote tissue healing. So we'll look at things like high volt pulse current, or HVPC, and iontophoresis to help promote tissue healing. So we'll get into that one in just a little bit. We can also use these electrical currents like direct current to help kind of push or promote transdermal absorption of these different medications. So iontophoresis is one that we'll look at, where we're pushing medication through the skin using this direct current, this electrical current. And then the last one that we're going to really talk about is providing electromyographic biofeedback. So you may just hear this term biofeedback in the clinical setting. But basically what's happening here is we are helping our patients develop motor control with some form of visual feedback, acoustic feedback. So we're giving this application isn't delivering a muscle, or I'm sorry, an electrical current to the muscle, but it is measuring that electrical current that's within the muscle. So if you could imagine somebody is having, let's say, like this spasticity that we were talking about earlier, if you apply these pads that are measuring electrical current through the muscle for somebody with spasticity, it may be going through the roof. It may read very high, as opposed to somebody who has low tone in their muscle where there's not a lot of electrical current flowing through that muscle. So we can visualize that on these biofeedback machines and try to help our patients either relax their muscles if it's overactive, or if it's underactive, hypotonic, then we can also help to maybe promote more of a strong contraction to that muscle belly. So there's a lot of different clinical applications that we're going to discuss in this lecture. So I just wanted to show you, we just discussed motor points and kind of their role, especially whenever you're trying to induce a muscle contraction. Here is a nice little motor point graph picture, almost a map essentially for where you can start to target these muscles. So typically they're going to be in the bulk of the muscle belly is where you want to apply the E-stim pads. So you can kind of see some of these starting up in the deltoid and the shoulder, moving through kind of the extensors on that posterior side, or I'm sorry, the anterior side, like the biceps brachii, and down the forearm itself. So this is going to be helpful for when we start to place E-stim pads to elicit muscle contraction on the upper extremity. And then I also have one for the lower extremity. So again, this is where you would want to place those E-stim pads in order to get the best muscle contraction. So by no means are these the absolute only places that you can put one of these E-stim pads or both of your E-stim pads, but it's going to be very helpful if you're trying to elicit a muscle contraction specific to, let's say, like the gastrocnemius. You can see they have one of those motor points on the medial head. We have a motor point on the lateral head as well. So maybe you would want to target those two heads instead of putting one kind of right in the middle of those muscles and then on the Achilles tendon. Probably not going to get as good of a contraction with that setup as opposed to the one that you're seeing here on the screen. Okay, so now let's look at this next slide here, which is a table of different terms that you're going to need to know, definitions, and then maybe some of the related terms that are going to help you in the clinical setting or in the lab setting. So the first term that we're going to look at is something that we call the rate or frequency. So what does that really mean? Well, the definition of rate or frequency is the number of electrical pulses delivered per second. So we have different applications like tens would be a good example where we have higher frequencies, which we call high rate tens. And then we also have, and those ones are used mainly for pain modulation in an acute setting, less likely to kind of cause some of these contractions that we're looking at. And then we also have something that we call low rate tens, which we can again use for something like tens, but this is typically used for muscle strengthening. So we'll talk about the rate and the frequency. We'll look at them in the lab setting, but some of the related terms that you may hear me refer to would be PPS or pulses per second and BPS or beats per second. So, just something to kind of help you think about when you start applying these applications. Like let's say you're going to do a low rate tens and you're getting a muscle contraction, you're going to feel these really short bursts or these short bursts of like contractions. So if you put it from, let's say, 2 to 10 for pulses per second, it's going to range from 2 pulses per second, which you're going to feel and see as a contraction, to 10 pulses per second. So you're going to feel that. If you get up into the higher rate, like 50 to 100 beats per second, it's going to be much harder to feel all 50 or 100 of those pulses, which is why we typically use higher frequencies for something non-related to muscle contractions. Then we also have what we call pulse duration and phase duration. So let's look at the pulse duration first. This is the total time of one electrical pulse, all phases in a biphasic pulse, which just means that it is changing from a positive to a negative charge for one entire pulse, essentially. These two different phases would be one positive, one negative. And that's often measured in microseconds, also referred to as a pulse width. So I know these probably aren't meaning a whole lot to you right now, but we will see this when we get into the lab setting. It'll make more sense to you all. Then we get to the phase duration. This is the half of the total pulse duration in a symmetric waveform. So it's either the positive or the negative portion of that pulse duration. When we look at related terms, it's the same as pulse duration for different monophasic waveforms, so measured in microseconds. We also have the amplitude. This is the strength or intensity of the current measured in milliamps or volts. And this, whenever we're thinking of like a lab setting or a clinical relevance to this, this is adjusted to patient tolerance to achieve whatever desired effect you're going for. So just how we were cranking up the little dial on our machines for our ultrasound to increase the intensity, we're going to be doing the same exact thing for our E-stim units. We're going to turn that dial up. We're going to either increase the intensity, which will either cause more of a contraction, or we're going to turn it down so that somebody can just feel that nice light buzzing sensation without achieving a contraction. So the amplitude is something that's going to be important, but we might also need some, let me back up. The amplitude is going to be important because we might need a higher amplitude for deeper muscle activation, while lower amplitude is typically just for sensory stimulation. So if we think of that gate theory of pain control, we're not trying to initiate a muscle contraction there. We're just trying to use some kind of non-noxious stimulus to block that sensation of pain getting to the thalamus and getting kind of sent out to the different cortical areas of the brain. So we're going to use a low amplitude to do that. If we're trying to really increase muscle strength, or we're trying to re-educate the muscle via contraction, then we're probably going to need a higher amplitude to get that muscle stimulated for a contraction. Then we get to the on-off time. This is the time the electrical current is active or on versus inactive or off. So we'll talk about this, but we'll see it a lot when we're discussing NMES and Russian stimulation. Typically for a muscle strengthening protocol, the on time is going to be about 10 seconds and the off time is going to be 50 seconds. So the contraction is going to last for 10 seconds, and then we're going to have a long off time so that muscle can recover and not fatigue as quickly. So it's going to be a 1:5 ratio in that instance. 10 seconds on, 50 seconds off. That relates to that 1:5 ratio. There are different on-off times that we are going to discuss and utilize in our lab setting, but that's what it's referring to. How much time is the electrical current active versus inactive? And then we have the ramp time here as well. This is the time it takes for the current to increase or decrease, and it just ensures gradual comfort for the patient. So if we go back to our muscle strengthening example here, you set the intensity, you set that amplitude to get a muscle contraction. The ramp time is really used to kind of gradually increase that amplitude over that 10 seconds. so that it doesn't just kick on to the max intensity from the very start of that 10 seconds. So maybe it builds up over 3 seconds, it builds up over 5 seconds, and then it lasts, or it kind of hits its peak, and then it remains at that constant for the remainder of that 10 seconds. So the ramp time is used just to make sure that your patient can tolerate that on cycle much better. Okay, so now we're going to start talking about different waveforms that we're going to utilize with different applications of electrical stimulation. So what does that mean when we're talking about waveforms, when we're trying to define that? Well, think of it as the shape and the direction of the electrical current delivered over time. So different waveforms are going to have different treatment outcomes, clinical applications, and it's going to be different based on patient comfort, right? So when we look at this sinusoidal waveform, the definition of it is a symmetrical waveform that alternates smoothly between positive and negative phases in a continuous manner. So we're going to see this type of sinusoidal waveform used commonly in IFC, or interferential current, and Russian stimulation due to its smooth nature, which is just going to enhance patient comfort. So we'll look at what this looks like in just a second. Then we're going to look at this symmetrical biphasic waveform. So the definition of this waveform is a balanced waveform with equal amplitude and duration in both positive and negative phases. So this is ideal for muscle strengthening, neuromuscular reeducation, because it minimizes skin irritation and ensures balanced charge delivery. So we'll kind of get more into that in just a second. Then we look at this monophasic waveform. So what is this? What does this mean? What is a monophasic waveform? It's a single phase waveform where the current flows in only one direction, either positive or negative. So this is commonly used in applications that induce wound healing, like high volt pulse current or iontophoresis, where we're trying to drive medication through the tissues. It's also important to know that this monophasic waveform creates what we call a net charge in the tissues that facilitates specific therapeutic effects, such as promoting cellular healing or reducing edema. So we can use different forms of electrical stimulation to create charge in the tissue, which would be better at promoting that cellular healing or reducing edema. And we'll get into more detail though with those in just a second. So the waveform choice can definitely influence our outcomes. Again, we're thinking of strengthening, for using muscle contraction to help strengthen, or maybe we're going to use something like a sinusoidal waveform to promote pain relief and relaxation, or we can use this monophasic waveform to initiate tissue healing. Okay, so on this next slide we have a visual representation of those different waveforms. And just remember that the waveform type really influences the physiological effect and patient comfort during treatment. So on the far left side, you can see this sinusoidal wave. So remember, this is that smooth, continuous wave that alternates symmetrically above and below the baseline. The current alternates between positive and negative phases in a flowing manner, making it gentle and comfortable for the patient. So this is one that you're going to see when we start looking at IFC. That's the type of waveform that we're going to be delivering. And again, you may see this as well in Russian stimulation. So because of this nice smooth transition, it's usually more comfortable, easier to deliver that treatment. In the middle, we have a monophasic wave. So you can see that we have these kind of sharper looking edges. It's not so smooth in appearance, but the sharp pulses only occur on one side of the baseline, so either positive or negative. Just remember that whenever we get this monophasic waveform, Current flows in only one direction per pulse, which is what you're seeing on the screen, and that creates a net charge, and this can influence cellular processes. So remember this when we start to look back at high volt pulsed current. Again, effective for wound healing, edema management, inflammation reduction, those kind of things. And then on the far right side, you're seeing, again, something that looks similar to that monophasic waveform in the sense that it's sharp and angled. It's not this smooth kind of transition like you would see on the sinusoidal wave, but the pulses are still alternating between positive and negative phases symmetrically, like we saw in the sinusoidal waveform. But we have equal amplitude and duration of positive and negative phases, ensuring that there's no net charge buildup. So not like the monophasic waveform where you're actually creating a charge in the tissues. Because we don't have any net charge buildup, this reduces skin irritation, making it safer for prolonged use. So you'll see this type of waveform in neuromuscular electrical stimulation, NMES, for muscle strengthening and reeducation. And we can also use it to help manage spasticity. So just to kind of give you a comparison, little of these different waveforms, just remember that sinusoidal wave, continuous, smooth, it's great for patient comfort. We're going to see that in the form of IFC. We have the monophasic single direction, typically used for wound healing. And then we have the biphasic current for safe and effective muscle stimulation. All right, so I'm going to have a lot of tables in these lectures, and I think it's important that you study these and get a good understanding of each of these. So this slide compares some of the key features of monophasic, biphasic, and sinusoidal waveforms, just to kind of help you understand their practical differences and uses. So when you look at the monophasic or biphasic waveform, this one is typically rectangular, square, trapezoidal in appearance, kind of like what we just saw on the previous slide. And the shapes of these waveforms allow for precise, sharp delivery of current, especially useful for muscle contraction or tissue stimulation, compared to sinusoidal, which is that smooth oscillating curve. This is ideal for continuous stimulation like pain modulation or muscle relaxation. So when we see the monophasic, or well, really the biphasic, we're going to have more of an on-off cycle compared to this sinusoidal, which is continuous. As far as like the amplitude stability, monophasic and biphasic delivers a consistent amplitude, making the current predictable and efficient for neuromuscular stimulation, whereas we see the sinusoidal amplitude stability, the amplitude is continuously changing, which provides a smoother sensation for our patient, and is again best suited for sensory or some type of other kind of therapeutic comfort like the gate theory of pain control. As far as the rise and fall for the delivery of these electrical currents, monophasic or biphasic, characterized by rapid, sharp rise and fall, like you saw on, again, the images on the previous slide. The sharp delivery is really effective for tasks requiring precise control like muscle strengthening. Sinusoidal features a gradual, smooth rise and fall, creating, again, a gentler stimulation that patients might find more comfortable. And then again, the bottom would be probably the thing that I would look at the most, kind of the top wave shape and the use cases. For monophasic or biphasic, again, remember that we're going to use these different types of waveforms for NMES, TENS, high volt pulse current, and then for the sinusoidal, we're going to look at more of IFC, Russian stimulation. So you need to kind of get familiar with what those waveforms look like and what their uses are in a clinical setting. Okay, so still talking about waveforms here. So it's important to know that those waveforms are categorized based on their shape. but they're also categorized on the flow of electrical current. So that could be continuous or uninterrupted, interrupted, unidirectional, bidirectional. So let's look at some of these here. So for direct current, this means that there's a continuous flow of charged particles in one direction. This is steady and uninterrupted current, and it produces a net charge, which can have a therapeutic effect, like when we use iontophoresis to deliver medication transdermally, okay? Or in HVPC when we're trying to create a charge in the tissue to maybe modify inflammation or help with wound healing. When we get to alternating current, this is a continuous flow of charged particles that alternates directions in a sinusoidal pattern, okay? So it's bidirectional and oscillating, meaning that there is no net charge buildup like there is with direct current. So it wouldn't be as good for trying to stimulate tissue healing like direct current would, like HVPC would. So again, we're going to use these types of alternating currents for interferential current, IFC, or Russian stimulation for muscle strengthening. Again, this is going to be more comfortable maybe than some of these other waveforms due to that nice oscillating nature of that waveform. And then what we have on the last one is pulse current. So the definition here is an interrupted flow of charged particles delivered in pulses rather than delivered continuously. So basically the current starts and stops, and that creates a series of pulses, much like what we would see for pulsed ultrasound versus something that is continuous ultrasound. So just remember again that this pulse current can either be monophasic or biphasic. So when we talk about monophasic type currents, they flow only in one direction, creating a net charge, HVPC. And then we have biphasic currents, alternating current with no net charge, making it well tolerated for longer treatments like NMES. Okay, so now we have another slide that will help with this visual representation of these different waveform types. So looking at the very top left corner, we can see that flat continuous line above that baseline indicating a steady flow of current in one direction. So you can also see that it's a positive current and positive voltage that we're creating in the tissues. It's not dipping down below that line into the negative range there. So again, we're creating a net charge, which can have physiological effects on tissues, really good for wound healing. This would be ideal for iontophoresis and like medication delivery transdermally through the skin. Then on the top right, we have the alternating current. So you can see that this current starts in a positive direction, comes back to baseline, dips below into the negative range. So showing that bidirectional flow. And these currents reverse periodically. So this isn't going to create a net charge. You can see that that current has an equal number or an equal amount of time in the positive range as it does in the negative range throughout the period of the treatment. So this oscillation between positive and negative is nice and smooth, which is comfortable for your patient. And again, the important thing here is that it doesn't create a charge in the tissues. Again, IFC or Russian stimulation is what we're going to see for those ones. Then we look at the bottom here where we have both biphasic and monophasic kind of pulsed currents, if you will. So one of the key characteristics here is that the current starts and it stops. This is what's creating that series of pulses. So it's an interrupted flow of charged particles. It's not continuous. When we look at the monophasic, kind of that bottom one, current flows in only one direction, creating again a net charge. This is what we're going to see for high volt pulsed current. Okay, it's pulsed, but it's still monophasic. We're getting charge only in one direction. As compared to the top one, biphasic, this is an alternating current. Again, there's no net charge buildup here because it's spending an equal amount of time in the positive and negative ranges. So we're going to see this type of waveform for neuromuscular electrical stimulation. And I created a table here just to kind of mimic what I was saying earlier on that previous slide. So you can see alternating current, direct current, and pulse current. It gives you the direction of the flow of this electrical current. With alternating current, that reverses periodically. With direct current, it flows in one direction. For pulse current, it depends on if you're using a monophasic or a biphasic waveform, but it can flow in one direction or reverse. So if it's monophasic, it's again one direction. If it's monophasic, if it's monophasic, it flows in one direction. If it's biphasic, it'll flow between the positive and the negative. The alternating current, again, something I've repeated already so many times during this lecture, smoother, more comfortable. With direct current, this is less comfortable because it's creating that tissue charge, which may lead to either even higher skin irritation. And if it's pulse current, this is generally more comfortable than something like a direct current, but it can vary, again, based on monophasic or a biphasic waveform. So you can see all the different applications for alternating current: IFC, Russian, TENS, direct current, iontophoresis. We can also use a direct current when we have denervated muscles. So we'll talk a little bit about that later. And again, direct current for HVPC, or really just monophasic would be the thing that you're looking for because it is pulsed, high volt pulsed current. And then you can see the energy source, which is not going to be as important for you to know. There's different types of electrical stimulation devices. So we have both of these in our lab setting. We have the larger tabletop units. So these can accommodate several patients at a time. Those would be like the towers that we have, the Chattanooga and the Richmar Tower. They have multiple waveforms available, and ours definitely do have ultrasound as well. We're going to try to use something like an alternating current, at least as far as the energy source goes. And then we also have something like these smaller portable units, basically which are single patient use, although they generally do have 2 channels. You're typically not going to share those ones. Most of the time, especially on the units that we have, I think we have one unit that has multiple waveforms, but generally only one waveform is available. The cool thing about these ones is that you can wear them, and they are battery powered, so that's direct current. But you can wear these smaller portable units for up to 24 hours a day if you're trying to use the gate theory of pain control to maybe help you get through your workday. Whereas opposed to the larger tabletop units, it's going to be really hard to lug those things around. So definitely some pros and cons to each of those, but luckily for you, we have both of these in our clinical setting or in our lab setting on campus. Okay, so that's going to end the introduction to electrical stimulation. Our next section is going to be on pain modulation. So check back for that video, and I hope this is helpful. If you have questions, feel free to reach out. I know the terms can be a little bit confusing, but I'll try to point you in the right direction for what you need to know for exams and things like that in the future.